Essentially now they look at about, in North America, we're looking at around 1 in 10 kids being diagnosed with ADHD.
So is that an indicator of just we have more awareness around it now, or help me
Yeah,
pull that apart?
I think the fact that we've got better diagnostic criteria and there's more awareness around it, that's going to definitely increase the amount of diagnoses around that, but that's not the only thing. That would be a part of it. So when you look at ADHD, you can get into lots of pieces around it. And essentially, I think even when you look at the criteria, I don't really know any particularly young boy who doesn't fall at some point in those criteria. So you're looking at some of the big ones would be things like you can have an inattentive sort of form of ADHD, and then you can have more of the hyperactive kind of part of ADHD, and then you can often have a combination of the two of them. So symptoms, anything from, you'll hear like they can't stay focused. Maybe there's some problems sort of socially and social interaction.
Right.
Usually there's hyperactivity and restlessness. They always have to get up and move around. They usually perform poorly at school, or their academic performance is less than to be desired. So the main thing though to look at, like at least for parents when they're seeing some of these symptoms, is that really for a diagnosis, it should be across the board in many different facets of life. So it shouldn't be that they're only like that at home, but they're totally fine at school. Mm-hmm. Or they're only like that at school and they're totally fine at home and around other people. It should be basically that situation continues no matter where they are.